Day. So yesterday's sessions offered a some conceptual discussion, particularly early in the day, uh, and a lot of model building in the later morning and throughout the afternoon. I attempted to interweave that model building with a variety of commentary on learning from those models. But I wanted to further underscore some points that were made in the course of that, but also um, potentially that need to be added to those perspectives. So yesterday saw us focusing a great deal on two issues that form important overlap, jointly emphasized in critical realist thought and in dynamic modeling practice, namely mechanisms, generative mechanisms, causal pathways. We can use different terms for them on the one hand, and outcomes on the other. So really the model building during the day was spent alternating, as it were, between these. And when we added mechanisms into the model, things like the introduction of a process of evolution of people's smoking status, or much later, ways in which that smoking status impacted those people's risk of developing heart disease, their current smoking status. When we added those mechanisms, we then often went and looked at the outcome measures we had captured, uh, the model outputs, as it were, the behaviors of the model, and particularly summaries thereof. But we also spent a fair bit of time, a great deal of time actually, uh, building up those summaries of various sorts and teaching principles in so doing more broadly about agent-based modeling, and more specifically about the particular platform we're using here, AnyLogic. So we saw, for example, how we could create cross-sectional summaries of the state of the model at any one time using what are called, in AnyLogic terms, statistics for a population. So we could very easily use that, for example, to count up the number of people with heart disease and without heart disease, or the number of current, former, never smokers, and combinations thereof. Current smokers with heart disease, current smokers without heart disease, for example. We also saw that with slight variations on that, we could do things like take a computer fractional prevalence over the population using what is in effect the average over an indicator function applied to the population. And we could apply those measures to an entire population, the count of individuals in the population who are former smokers overall, or in subgroups of the population, those who are former smokers without heart disease, with heart disease, or those who are former smokers and over age 50 or below age 50. One of the important mechanisms that we did capture was one associated with aging. And there, though I didn't really emphasize it, I didn't emphasize it in a prominent way anyway at the time, by introducing a continuous measure of age, we were able to fruitfully use that the age that was so captured very flexibly across the model, confident that it captured at whatever requisite level of granularity was needed for a particular criteria. So if our interests were in looking at changes in the very earliest years of life, first few months, or changes in the oldest years or in the middle years, we didn't have to worry about some sort of pre-chunked, pre-aggregated age categories or age groups. We could instead reason about someone's underlying continuous age. But we also saw that, from a standpoint of implementation, we captured that with an economy of mechanism and computation. We didn't have to constantly update people's age. We could simply compute it, their current age based on the current time minus their birth time, which was an elegant way of capturing this in a manner that is at once continuous and computationally frugal. Now, these outcome measures that we were describing are, for all the cases we examined, epiphenomenal. What I mean by that is that those measures were not influencing further model evolution. They spoke to us and summarized to us aspects of that evolution, little summary measures of this and that, of a very descriptively and indeed dynamically complex underlying situation. But they weren't themselves part of the governing processes of the model, part of the things driving the model. There are cases where we use some of those measures additionally to drive things in the model. Perhaps we have a targeted intervention underway in the model, which plays out over time and focuses on those of a certain age, or indeed of a certain smoking status. Perhaps in a communicable disease situation, there's an outbreak, and that outbreak triggers, once cases rise to a certain level, some public health measures, some public health response. Maybe it's a work from home order, maybe it's a school closure, or what have you. So there are times where these summary measures, these outcomes, do drive model dynamics, but a large fraction of the time within our models, they are epiphenomenal. But as we built those up, we actually introduced something more than kind of the measures themselves, the scaffolding that computed things. We actually started to introduce processes of sorts whose job it was to report these epiphenomenal measures. So I think to make this a little bit more concrete, I'll remind us by going and pointing at my elements of the model here. But you may recall that within this model, we had, for example, a histogram that was updated every year and which reported the age distribution of the population in that year. And indeed, even these charts here, these time plots, were updated with a certain frequency. So every year, 1 year. So models that we built, that we build in this boot camp, and models in agent-based modeling more generally, or dynamic modeling, depict processes that involve evolution of some state of some system over time. But they also involve processes commonly that are epiphenomenal, that are reporting on that, but also take place over time, say at some periodic points or based on some conditions within the model, etc. So once a new variant of infection has been discovered in wastewater, perhaps there'll be some regular reporting on it, etc. So we introduced these processes that were observation processes, and we put in a fair degree of mechanism for that, statistics and in the population, various types of figures, various types of plots, time plots, histograms. And we saw for this particular package, that software package, that there's a variety of constructs that accompany these, not just histograms, but histogram data objects, for example. And affordances like the ability of a plot, a time plot, to call off to retrieve its data, say, from the population, to call the statistics in the population, to request that certain statistics be computed over the population. And AnyLogic provides a variety of tools within the analysis toolbox for this. And we'll be exploring more within the course of the bootcamp, and indeed the course of this very day. Things such as scatter plots, which can be exceptionally powerful, particularly insightful, when applied with individual level data points from people, capturing certain relationships, certain associations. And when we're building up a model out of those pieces, we can often with an economy of effort, achieve quite a bit of functionality, and do so declaratively, sort of saying what we want it to characterize, and it will make that happen under the hood. There are times you'll want to be aware. In fact, increasingly common with a large model, you'll need to be aware of some aspects of how these things operate. For example, that when computing each statistic, say on the one hand, the number of people of ages 0 to 10, another of those between 10 and 20 years old, and 20 and 30, etc., that upon each request to that statistic, say, associated with the population, it'll scan the entire population and count those satisfying the criteria just for that statistic. And while that may be acceptable for a smaller model or a model with a smaller number of statistics, if you're computing statistics frequently on a large populations, you'll often want to give consideration to taking a more judicious approach, such as sweeping the population, and in that sweep, going through each person in the population, sorting them as to what bin of age category, as it were, according to your classification that you want to report they belong, whether they're in 0 to 10 or 10 to 20 or 20 to 30, and just keeping the tally for each of those rather than doing one separate sweep for each of those. But we also saw that there are some limits, or there are certain types of statistics, particularly longitudinal statistics, for which this particular package, and the truth is most agent-based packages, fall short in fully supporting. So I would remind us that within this model, for example, when people passed away, we added one to a tally of cumulative deaths. We kept track in Maine, hence Maine died, of the number of people who had died in the population. And we incremented it each time a death had occurred. This is a longitudinal measure. It captures a count over time. And there are many interesting such counts, both like this one at an aggregate level, cumulative count across the population. Another example might be a flow as measured by the total number of people in the population that have developed heart disease in the past month. That's an aggregate measure as well. It's a longitudinal measure, measures it over some period of time. Or at the individual level, the number of times in the past year I've relapsed into smoking, or a number of times I've quit. These sorts of measures, whether individual level or aggregate, are less well supported. And we will see that for agent-based modeling, these sorts of measures are of enormous value when characterized. The same thing is true at an aggregate level with stock and flow models and aggregate populations. For flows, they're a core part of our insights. Indeed, they drive our insights into the dynamics of stocks. If the inflows are greater than the outflows, we know the stock will be rising. Some of the inflows is greater than some of the outflows, we know will be rising. If the sum of the outflows is greater than some of the inflows, we know the stock will be driving. If the two are equal, we know it will be in stasis in an aggregate context. But at an individual context, they're also equally important. And as such, it's important in this boot camp that I convey ways of accumulating them. And indeed, some of the most valuable measures for relating to people's lived experience come from history measures at an individual level. So we'll be expanding on these in the coming day, with things like recording the number of times a person has been infected, which might have important bearing not only on what you report from the model, but potentially endogenously within the model. Not just reporting it outwards in an epiphenomenal way, but governing the model might yield important measures for targeted interventions. We might focus on someone who's been to the STI clinic at least 3 times before for behavioral counseling, or something similar in a dental practice. If a person has had many issues with needing fillings within a period, we might engage in behavioral counseling and see if we can adapt dental or oral health measures for their particular context. And these measures have very limited support by any logic, and indeed by all platforms except the one in which I'm working. But they are some of the most potent ones for insight and for relating to people's lived experience. And as such, I'll be spending some time on them in the coming days. Another issue brought out by yesterday's discussion, though, was the challenges of interpreting drivers for causes for the particular mechanisms that are contributing most to certain patterns that we observe over time. And indeed, this caught us and perhaps captivated us during the final hour of yesterday's session. with particular intensity in the final half hour as the clock ticked down, as it were, trying to figure out these counterintuitive results that we were securing from our models. And you can go see this in the videos, which I spent a while last night trying to curate and make sure are posted and labeled appropriately. But that sleuthing was focused on the fact that while we had this very model depicting people's currents, their smoking status, and their health with respect to heart disease in a dichotomous way, and mortality. And whilst smoking behavior materially impacted the risk of developing heart disease, where reflecting the fact that heart disease risk for current smokers was, in this case, 8 times. So if one is in the current smoking state, on a per year chance of developing heart disease, if you haven't yet developed it, the hazard rate of developing it is over 8 times, or is 8 times as high in current smoker state as in the never smoker state. And yet, when we were running this model, we were puzzled, perhaps perplexed, by the fact that the smoking rate, the heart disease rates among those living at the model's end did not seem materially reduced for the anti-smoking interventions. Even something as dramatic as lowering the risk of relapse and enhancing the risk of cessation, or even more so, of eliminating initiation, just did not seem to materially lower that prevalence of heart disease in the population at the final time. And even more perplexingly, a measure that was put in hopes that it would materially clarify the situation, added to the model to add to our insight, which is an important pattern of what we can do with these models. We can add in these measures to clarify what's going on in the underlying model, to help us understand drivers for behavior. Even so doing, adding in a measure of cumulative mortality, the one I just showed you a few minutes ago, this number of cumulative deaths, we found that, surprisingly, perhaps shockingly, seemingly perversely, the number of cumulative deaths was higher for the cases of these potent anti-smoking interventions than it was for the case of the baseline. And it seemed surely to be absurd. But we wanted to know where it was coming from, what was causing this, what could possibly explain this anomaly. And we probed it, and there was some thought in my part as to wanting to make sure we weren't thrown off by stochastics involved. We weren't laying undue emphasis on unreliable statistics due to small sample sizes. So I ended up running the model for different scenarios 5 times each, and so on. But the pattern did seem to persist, that there were more deaths actually occurring for that case of anti-tobacco interventions. which again thickened the plot. And what we tracked down, and it's memorialized in that very video, took advantage of another key affordance of models, another key advantage of having a model to debug our thinking, compared to it just being in some inchoate or oft inconsistent way in our head, our mental model. We had a model where we could turn on and off effects. And this is something we use frequently. One might say sometimes with abandon within these models. Because if we see puzzling patterns in the model compared in contrast to the world, we can upregulate or dysregulate or deregulate, downregulate certain phenomena and see how they affect things. Or we can turn off, in many cases, certain phenomena altogether. And by choosing an appropriate mechanism there, by specifically introducing a no birth situation where we had a birth rate of 0, that's all it took, right? Birth rate of 0. Setting the birth rate to 0, that's what, in this case, it means turning it off. Doing that for the baseline, doing it for the no initiation case, and similarly for the smoking cessation and relapse case, where we up cessation, lower relapse. What we found got to the heart of the matter. When we disabled the impacts on birth rate, or births of these interventions, what we found is that the anti-tobacco interventions save lives, reduce deaths, and materially lowered the prevalence of heart disease. What was confounding our understanding, the bug in our thinking that was identified through this, my thinking as much as anyone, was that in a model with an open population and with births coming in, where the occurrence of that birth requires some parent to give birth, within the first generation, the initial cohort in which these interventions took place, the success of those interventions, and indeed that no birth situation showed it was a success in that population, keeping people alive longer, meant that there were more children being born for the coming generations. And those children begat other children for generations hence. And the statistics that we were seeing on cumulative deaths reflected those future generations that were made possible in this model by people keeping people alive, that noble achievement in the index generation, in the first generation, initial focus of our intervention. And this situation without births made it clear that yes, we were saving lives there. By so saving those lives, by having them live longer, they were giving birth to more kids. That was leading to future generations who were then dominating the statistics. And so those higher number of deaths that we had seen in that case of the anti-tobacco interventions reflected deaths heavily in those later populations, later generations. we did a noble thing by keeping people alive. We made more lives possible in future generations, but when you make more lives possible in future generations, you make more deaths possible in future generations too. Deaths that otherwise wouldn't have occurred if a person hadn't been born. And that was perplexing our thinking. And indeed, the statistics at the final time that seemed to show no huge difference in the number of people who were with heart disease or not were dominated by future generations. So by turning off those effects, by allowing us to focus on a cohort, it debugged our thinking and allowed us to confirm our understanding of the impact on a given set of individuals that were impacted here. It also helped bring to the fore model scope limitations and consequences, in the sense that right now births are occurring in a manner that's independent of age. And the statistics would be such, and this would be borne out if we wanted to record this, that the deaths that are occurring from heart disease tend to occur in later years. The risks have accumulated enough that's when it, it tends to take a while for it to lead to someone to develop heart disease and then death. Moreover, it takes a while for someone to become an ever smoker, which materially raises the risk of developing heart disease, and those to contribute to deaths here. And all those mean delays along all those processes, which means the people predominantly dying from heart disease tend to be older, not because it's baked in, not because it's hard-coded in. It's emerging results of the process. We saw that yesterday, writ large. There is no dependence right now of age on developing heart disease. It's a dependence on smoking status, but it induces a marked age disparity, right? A marked disparity in the ages, in the age-specific prevalence of heart disease across, for say those 50 and up versus those less than 50. We saw that. So the fraction of heart disease among those less than 50 was down here somewhere between 20 and 30%. And the fraction of heart disease among those 50 and up was up there upwards of 50%. And, sometimes rising above 60%. So a factor of nearly 2. So this is not because we hard-coded that in to our assumptions about who develops heart disease. Just because there's an association in the data doesn't mean, or an interaction term in the data, doesn't mean that there's a causal interaction. It may be explained as a result simply of the processes that are already there. And indeed, this disparity by age, this marked disparity by age, comes about as an emergent property of this model. This is in contrast to something like this disparity among those fraction of heart disease among current smokers compared to former smokers here, where we have a causal factor that drives that. The fact that those who are current smokers have a materially higher risk of developing heart disease on a per year basis than those who are never smokers. That induces a large disparity here. But some of these associations simply result from the processes, the underlying processes involved, and don't require any sort of um, uh, special casing to take this into account. They are the natural result of the delays here involved in these various processes of becoming a smoker, developing heart disease. You will see these disparities develop. And so I urged caution yesterday in um, thinking how much, because we see associations in the population between different things, say between age and heart disease, that we necessarily have to build them in to the generative assumptions of the model, the assumptions of the generative pathways. There may be effects of that sort in general, and I don't deny that in this particular case, there probably are age-specific effects. But one has to be cautious about an impulse to turn observed associations into assumptions causally, because often those associations have very good explanations without, while still assuming a very parsimonious model where there's no difference between the at a causal level between the impacts of say different ages. So that was an important observation and something I sought to emphasize yesterday. The same thing could be said between like the associations between smoking status here and age. The people who will be never smokers will tend to be younger here. Those who are ever smokers will tend to be older. By contrast, there won't be too much difference between these two because they go back and forth. So commonly, just like if we look at the fraction of heart disease, the fractional prevalence of heart disease among those who are, former versus current, they're more or less overlap because for all intents and purposes, this is a very well mixed group. They're going back and forth so frequently that the fact that they're a current smoker now doesn't mean they are likely to suffer a much higher chance now of developing heart disease, because chances are they were a former smoker a short time ago, and they're and a current smoker before that, and a former smoker before that, and someone who's a former smoker now was probably a current smoker earlier, and so they're very well mixed. But there's likely to be a pronounced disparity in the age distribution between never and current. So that was a little point about associations and being cautious, because many associations that we observe in data can be explained generatively by a parsimonious understanding, an understanding that doesn't require hard-coded assumptions about the effects of X or the effects of Y. Now, that general point, though, and this challenge of explaining emergent patterns, why the number of deaths is larger for anti-tobacco intervention scenarios, it brings home, I hope, the point that when we're dealing with complex systems, even ones of rather modest complexity like this, there's a lot of interacting pieces. There's a lot of moving parts that influence each other in ways that are dynamically complex, that are textured, that are articulated, and that you really need to think through carefully before jumping to conclusions about them. And here, models provide us this toolbox for testing our thinking, both by very active building a model and running it in a simulation and running it. We can see what associations emerge from that. And if we're thinking about capturing disparities or inequities in the population, we'll want to be asking, okay, which of them might require explanation beyond what we see coming out of these set of factors we see here in the model. More than this, within these models, as we've seen, we can put in observations at key points of our choosing. We have sort of a God's eye view of this. And by choosing to record information on, say, number of new deaths, or the time at which people become develop smoking, or the age at which they've developed heart disease, or the age at which they die, the age at which they start smoking, we can gain insights to what's going on that sharpen our thinking about these patterns that we observe, these broad associations that we observe. And that sharpens our mental model. That sharpens our thinking. By cutting through blind spots in our thinking, by cluing us in to gaps in our understanding that need to be remedied so we don't misinterpret data from the world. But also highlight gaps in our mental model translated into a dynamic model that may need to be remedied for it to be adequate. Maybe we want to make the birth rate dependent on age. So it tends to occur among younger people who'll be ones before they die from heart disease, right? And therefore it'll be the number of kids that they have will be much less affected by the occurrence of an anti-tobacco intervention. So these measures that we put in, these outcome measures, are really important, not just to get a sense of the model's working, but to debug our thinking and to accompany experimentation with the model, where some of those experiments, like the one where I turned off initiation or where I turned off births, are not to depict some real-world circumstance in some specific epidemiological context, but they're tools for debugging thinking, for understanding, for helping foster understanding. A few other points and we'll get going. One is within this model, we incorporated multiple types of processes. Processes of change of smoking status, processes involving development of heart disease, processes involved in mortality. And you'll notice here that these types of processes are described kind of in parallel, as it were, by these two state charts, with this state chart having the scope including heart disease and mortality. That's not to deny there's an interaction causally. There is an interaction causally through this heart disease hazard rate. But the ability to carve off these different areas of concern into different state charts affords us an expressiveness, but an economy of expression that is really quite admirable and is vastly preferable to the sort of combinatorial explosion that comes when we have an aggregate model and we try to break it down by, disaggregate it by, stratify it by multiple concerns, where the different subscripts start to obscure the core logic of the evolution of any one of those conditions. I'm not going to belabor this point too much, but it is one we'll come back to in a few days when we talk about, probably tomorrow or Friday, when we talk about stock and flow models, because it's an important consideration with heterogeneity. Stock and flow models have enormous power and insight that they offer. They have areas where they just excel markedly and provide superb insight. There's also places where, like with large amounts of heterogeneity, they can really bog down and become less transparent. Here we can divide up our understanding into multiple pieces in a way that's quite understandable, that can allow us to focus on the underlying processes, but can still capture interactions. I do wish there were a way in any logic to show visually that the state you're in here impacts the risk of developing the transitions. And a decade ago, we suggested that, and it's not yet been acted on. But one thing or another will come about in the fullness of time that will better capture this. We sometimes draw little visual elements that show a dependence here to make that driving dependence clear. The art of building these models, I hope it's becoming clear. Like much of the motivation for system science more generally lies in the connections. We have this palette, and we can go, for example, to this area of the agent palette. But the real power does not lie merely in any one of these pieces, but how they're arranged, how they're interconnected, the relationships between them. It's about the connections. And much of the art of doing agent-based modeling, and indeed any of the three sorts of modeling, system dynamics or discrete event simulation as well, in any logic, is about taking these pieces, but then arranging them, interconnecting them in a manner that they work together. And indeed, there's often logical chunks of work that cross over different areas. Again, a point I've made to any logic, in which I hope someday maybe they'll work to make simpler. But often we accompany a state chart here with, for example, statistics. So we have a smoking state chart, and then we have statistics that accompany it to do summaries of the population according to never smoker, current smoker, or former smoker. And maybe we have combinations: heart disease among current smokers, heart disease among never smokers. So when we have these state charts, often it gives rise to associated statistics, also gives rise to the statistics are often accompanied by time plots, for example, or by histograms for if we have continuous measures. And much of building up these models in an artful fashion is about knowing how to make those work together cohesively so that you can follow through the logical connections between those in a fashion. So having built a state chart, you can go add the statistics, you can go add the analysis tools, be they time plots, scatter plots, histograms, etc., that might make use of that state chart, interactions thereof, in ways that will communicate the results of that model. And we've seen that these little snippets of Java code we've been adding, some smaller, like these, and declarative, some larger, like here, where we loop through the population and populate this histogram, provide us this glue, this linkage. Right. Okay, so those are some thoughts on yesterday's, the experience of yesterday. I took a lot of care to get videos broken up into small pieces and posted them appropriately labeled. And I'm hoping to do the same today. What do we have on the docket today? Well, look, yesterday focused on mechanisms and outcomes. At the level of a single person, we summarized it up across the population, but we didn't really have context characterized. And dynamic modeling, like critical realism, is about context, mechanism, and outcome. And today we're going to be focusing on context. Network context and spatial context. But before we do that, I want to finish off in a coda to this model to just show you one more thing that's very naturally introduced by this model and that bears on that scope issue that was identified in those results from last night, namely make age-specific birth rates. Okay, so we'll be doing that, and then going on for the rest of the day, really focusing on network effects and spatial matters. We'll also be looking at communicable disease for the first time, but more broadly for interaction between people in ways that were not present in this model. Okay, so 25 past. Why don't we take a 5-minute break? I could take any questions then, and then we'll go and dive into finishing off this model and then proceeding on to networks. So we'll see you in 5 minutes. Thanks.